Hi, my name is Dr. James Weiner. I'm director of the Weiner Wellness Center. We're located at 2419 Baldwick Road, Pittsburgh, Pennsylvania 15205. Our phone number is 412-922-WELL or 412-922-9355. Our website is drweiner.com. We're also on Facebook at Weiner Wellness Center, as well as James Weiner, and on Twitter at drjamesweiner. Today we're going to talk about bone health. Okay, can you tell me, do you have the same number of bones now that you had when you were born? No, the answer is no, because you didn't have any bones when you were born. It was all cartilage. And then over the next 16 years, your body turned that cartilage into bone. In fact, one of the last places to turn into bone is this bump right below your knee called the tibial tuberosity. It actually is a separate piece of cartilage that then adheres to your tibia, your leg bone, somewhere around the age of 16. And that explains Osgood-Schlatter syndrome. Have any of you ever heard of that? Anyone ever hear of Osgood-Schlatter? Now, unfortunately, the medical community calls that a disease. It's not a disease, it's a condition where young children are maybe very active athletically, and then they develop quadricep muscles, and the end of the quadricep muscles, there's 4 muscles, forms a tendon that inserts into that little bump. And if those muscles are tight, they start pulling, and then you get irritation at that very weak point because it's still cartilage, and that's called Osgood-Schlatter syndrome or condition. The answer to that is muscle therapy that we do in our office. We loosen up those muscles, we show the kids some stretch exercises, and usually in 1 or 2 visits the problem's corrected. So there's this whole concept, you can't hear. You can't hear, move up here. Can everyone else hear?
Yes.
Okay. All right, so the thing is that what we want to talk about is bones and also joints today, and a lot of people have pain in their joints, and they're told it's arthritis. They may or may not have changes in their joints. Arthro means joint. It may be tight muscles. I just gave you an example, Osgood-Schlatter, where the quadricep muscle is pulling on the insertion point, the tendon that inserts into the tibial tuberosity, and then you get pain there if you're a kid. As an adult, it's not as common. So I mentioned that even though the talk is supposed to be on bones, but you can't talk about bones without joints. Do you know why you have bones? What are some of the reasons you have bones? Wait. Well, it's the structure for your body, yeah. We're not a jellyfish. Jellyfish don't have bones. Cats, dogs, humans, monkeys, elephants, we all have bones. So it's a structural thing. Your bones also manufacture blood cells in the bone marrow in the center of the bones. The bones are basically hollow. They're hollow tubes. So what happens is, from the time of birth until you're about 16, your body starts mineralizing the cartilage and it turns into bones. You did that without any medications. You weren't taking any Fosamax, Evista, Beniva, reclassed. Anyone on those drugs now? Anyone on bone drugs? No, you used to be, but you're off. So the thing is that you initially started out with cartilage. By the time you're 16, you had all these bones. Approximately 106. Different people have a different number of bones. I didn't know if you knew that. Some people have 13 pairs of ribs. Some people have 11. Some people have 13 thoracic vertebrae. Some have 11. Some have 6 lumbar vertebrae. Some have 5. So there's a little variation of a couple bones here or there. Everyone has 7 vertebrae in their neck, 7 neck bones. In fact, every mammal has 7 neck bones, whether it's giraffe or a dog or a human being. Giraffes just have bigger ones. So we have approximately 106 bones. And the thing is that the bones only have nerve sensitivity on the outer surface, the outer sort of skin of the bone. What that means is if you have bone loss, you may have no pain or symptoms. If you break a bone, you may have some pain because you've broken that outer cortex, the outer part of the bone. But if you have bone loss, you may not know that you have bone loss. That's called osteoporosis. Now, there are a number of causes. If your diet is too acidic, then your body has to take minerals from your bones and your teeth and your muscles, etc., to neutralize that acid. Anyone here drinking soda pop or cola? It's a good group. Now, I gave you information. Pass it on to someone who is drinking soda pop or cola. I'm always surprised how many adults I see drinking that. Whether I'm on an airplane and it's a person sitting next to me, or I'm in the checkout line in a grocery store buying my paper products because I don't buy food in the grocery store. A lot of people are buying cases of this stuff. So that's one reason why you might have too much acid is you're drinking phosphoric and carbonic acid in soda pop. Also, tea and coffee. Most teas and coffee are acidic. Once again, you have to have an alkaline pH in your blood, which is the opposite of acidic. And so if you're consuming things that create a lot of acid, your body's going to have to leach out minerals from your bones, teeth, muscles, etc. How about meat? Anyone eat beef here? Chicken, fish, pork, cow dairy products like milk, cheese, ice cream. Now we have an entire packet, which I probably should have passed out, and I think at the end I'll bring it out because that's a packet I should have given you about bone health. And amazingly, people have bought into the myth, into the propaganda that dairy products build bones. Dairy products ruin your bones. But this is propaganda from the National Dairy Council. In fact, at one time, the National Dairy Council had a monopoly on nutrition information given to school-age children. 20, 30 years ago, virtually all the schools in the United States were using materials supplied for free by the National Dairy Council. And of course, they had the 4 food groups. Anyone remember the 4 food groups? You know what group number 1 was? It was dairy. They were saying you needed something from each one of these 4 every single day. Of course, you can live your whole life without any cow dairy. But that was their propaganda, so a lot of people believed it. And then they saw all this stuff on TV, and then the commercials, the ads, using celebrities on the billboards with the little white mustache, got milk, and all that. So you remember all the propaganda campaigns, a lot of disinformation. So studies have been done around the world, and they have found that because of the high phosphorus content of milk and cheese, that it actually causes an acidic condition which then leaches out minerals from your bones. So dairy products do not build bones, they ruin your bones. We have all this information over there, and I apologize that I didn't get it to you before the lecture, but right afterwards I'll pull out a stack and hand it out to everyone. Now, if you're eating beef or chicken or fish or eggs, these things also cause acidity in the body, and too much of any of that will create an acid condition. Your body will be too acidic, and once again, then you have to pull the minerals out of your bones and teeth and muscles, etc. So you really need to be eating at least half your diet should be fruits and vegetables. You ought to be eating at least a salad a day. And the more fruits and vegetables, the better off you are because you're getting a lot of minerals that way and you're alkalizing your system. You're also getting about 80 to 90% water. That helps to flush out the system as well as hydrate the system. And then bowel movements, we need to talk about bowel movements. How many bowel movements do you think a person should have a day? Now, Myrna's saying 3. I would say that it should be at least 1 for every meal that you eat. So if you eat 3 meals a day, that would be right, three bowel movements. If you eat 1 meal a day, which I normally do, I have 3 or 4, even though I only eat 1 bowel movement, because I'm eating so much fiber and all the fruits and vegetables, being a vegetarian for 45 years. And of course, we talked about the colon yesterday. Death begins in the colon. Was anyone here at yesterday's lecture that I gave? No one? Whole new crowd. Well, yesterday we talked about how important it is to assimilate your food in your intestines. And if it's rotting in there, you can have all kinds of problems. And of course, if you're eating a lot of dead animals, then it will sit inside your body. How warm is your body inside, do you know? 98.6. Okay, now he's saying 98.6. Of course, that's your tongue. It's probably about 100 degrees, probably a couple degrees warmer inside your core. And if you took a pound of ground round, wrapped it up in maybe some saran wrap or put in a paper bag and stuck it in a trash can outside when it was maybe 90 degrees outside, and left it in there for 3-4 days, it'd be pretty rotted, wouldn't it? It would smell pretty bad because inside the can it's probably going to be over 100 degrees. That's what's going on with people that are very constipated. Their food's rotting inside their body and they're absorbing it. This all has an impact on arthritis and various other diseases and bone loss. Okay, so you don't need drugs. Does anyone know how these bone drugs work? Are they rebuilding your bone? Okay. Well, we have to talk about how you build bone in your body. Now, do you have the same bones now that you had 20 years ago?
No,
Really, where'd they go?
they're replaced.
Exactly. Kathy's right that you were replacing every cell in your body at least once every 7 years. You have new intestines every week. You have new bones every 4 to 7 years, depending upon how rapidly it's changing over. Probably when you were in your 20s, you had new bones every 4 years. If you're in your 60s or 70s, like I am, maybe it's every 7 years. Every cell is replacing your bones. Now, you have 2 basic cells that are involved. You have the osteoblast, with a B like in boy, and you have osteoclast, C as in cat. The osteoblasts build new bone. The osteoclasts break down old bone because the bone starts degenerating and wears out. So your body has to get rid of the old bone and rebuild new bone. And if it's doing it at an equal rate, then you're going to have the same density of bone. But if you end up breaking down more bone than you build new bone, then you're going to have a net loss and you're going to move into osteopenia and then osteoporosis. What the bisphosphonates do, the drugs like Fosamax, Avista, Reclast, Beniva, Reclast, all these drugs, what they do is they stop the breakdown of old bone. So then what happens? Within 4, 5, 6 years, all you have is old bone. What's wrong with old bone? It's very brittle. So people have spontaneous fractures. You know, they'll say, well, someone fell and broke their hip. Well, very often what happens, they broke their hip and then they fell. So taking these bone drugs do not rebuild new bone. They just stop the breakdown of old bone. That's not what you want. What you want to do is rebuild new bone, like you were when you were 20 years old. What do you think is required for that? Nutrition and proper digestion. You see, it's a totally different approach than the medical approach. The medical approach is to treat the symptom. What we want to do is correct the cause of the problem. So you'll go to the medical doctors. Maybe they take an x-ray, and it takes about 50% bone loss before you even notice bone loss on an x-ray, so it's not a very good technique. It's not sensitive enough to determine whether or not you have bone loss. What's the hand flashing? Okay, well that's a different thing. That's a bone infection. We'll take questions in about 10, 15 minutes, and then we can address that, okay? I want to try to do this sequentially. If we start getting, it's an important question, but it doesn't fit into what I'm talking about right now, so let's hold off about 10 minutes. So anyhow, you know where I was? I don't know where it was. No, I know where I was. We're talking about building bones. When you were 6 months or 2 years old or 5 years old, you were building bones because hopefully you were getting the nutrients you needed and were assimilating them. Now, when you get to be 40, 50, 60, 70, 80, 90, you don't digest food very well or as well. How many people are on antacids? Anyone on antacids? This is a good crowd here. Antacids are one of the reasons that people have bone loss and bone fractures because they're stopping the production of hydrochloric acid. You need hydrochloric acid to digest your food, and also it's part of your immune system. It kills out bacteria, viruses, and other pathogens or disease-causing organisms that get into your stomach from breathing, swallowing beverages, and eating food. If someone has GERD or acid reflux, it's not because they have too much stomach acid, it's because the stomach acid's in the wrong place, because the stomach's in the wrong place, and we have corrected that. In fact, my representative over at KDKA contacted me via email the other day and said he was having this problem that he had had once before, and I corrected it. So he came over and I did a hiatal hernia maneuver where I pushed on his chest while he was breathing in and out. We coordinated with the breathing, and guess what? He emailed me today and said his problem's totally gone. Had he gone to the medical doctor, he would have been put on antacids, and then he might end up with osteoporosis or infections in his digestive tract. Once again, just treating symptoms. So you need enough hydrochloric acid. Most people over the age of 40 don't have enough. So then you might need digestive enzymes, like our betazyme or cybezyme or probezyme. I take digestive enzymes with every meal because I figure at 68, my digestion's not what it was when I was 28. I feel like I'm 28. Someone just asked me that today. They said, are you slowing down? Do you have the energy you used to have? Yes, I have probably more energy than when I was in my late teens because I'm eating better. But you need to assimilate your food in order to build bones. Now, what's a good natural source of minerals? Fruits and vegetables, I just told you that, especially green leafy vegetables. Anyone on Coumadin, warfarin? Anyone on that here? Well, you probably know people that are on this. When people have a history of heart disease or stroke or irregular heartbeat, AFib, the doctors will prescribe Coumadin because they think by thinning the blood, they're going to prevent strokes and heart attacks. I'm not convinced that happens. I was in a restaurant last week in Florida, and there was this man sitting across from me in shorts, and his legs were purple because he's obviously on blood thinners and he's bleeding under the skin. If he's bleeding under the skin, he's probably bleeding in his kidneys and various other vital organs. And if he gets bumped, it could all be over. A friend of mine's mother bumped her head slightly climbing up the stairs. She was on Coumadin for AFib, and she died 2 days later of a massive brain bleed. Now, we're not telling people to get off medications. We're just trying to explain what's going on. Americans are only 4% of the world's human population. We're consuming 75% of the world's drugs, and we're 72nd in health, according to the World Health Organization. This is not working because people are over-medicated. Medical doctors think you have too many organs and not enough drugs. That's supposed to be a joke. I heard a few chuckles. It's true. So how are we going to build bones? Well, you might have to make up for lost time. Let's say you have osteoporosis, frank bone loss. Just trying to get it from food may not be enough. Taking digestive enzymes with your food may not be enough. So I've put together a protocol, and you all got it here. It's called Bone Solutions. Anyone watching this video can call our office or email us or whatever, get on our Facebook pages, and we'll send it out. Now, the bone solutions, you'll see numero uno, SuperCal Plus. This is a product I put together. It was one of the first products I put together for Nutritional Frontiers because I found that even the top-notch brands that we carry in our store did not have what I considered a comprehensive enough bone formula. And calcium, not all calcium is created equal. Is anyone taking antacids like Tums for calcium? Oh, this is a good group. I just told you need stomach acid to absorb minerals. If you're taking Tums, I don't care how much calcium's in there, you're not going to absorb the minerals because you're neutralizing the stomach acid. It's not a good source of calcium. How about calcium carbonate from rocks or chalk or seashells? Very hard for your body to absorb that. So different forms of calcium have different rates of absorbability. So we've put in here the hydroxyapatite, and it's from bones from New Zealand, where they're not allowed to use antibiotics or hormones with their cattle or sheep or whatever. We also have vitamin D3. You'll see at the bottom there we recommend vitamin D3. We do have some vitamin D in the SuperCal Plus. And what's amazing is medical doctors always said that all you need to do is eat a balanced diet. But now a lot of them have learned somewhere or other that most people are deficient in vitamin D3. And so a lot of people are being prescribed vitamin D3. Anyone prescribed vitamin D3 by a medical doctor here? Was it like 50,000 units a week? Okay. All right, so what I liken this to is, let's have you go 6.5 days without eating anything. And then on the 7th day, why don't you eat about 25,000 calories? Be ridiculous, right? Well, that's what they're doing. They're giving you 50,000 in one fell swoop. That's not natural. It'd be better to take 1,000 or 2,000 or 5,000 or 10,000 a day and spread it out a small amount every day. But they're starting to discover that people are very deficient in vitamin D. And this affects the immune system. In fact, all of our cancer patients we put on vitamin D3 because it's part of the immune system. We do have some of that in the SuperCal Plus. We also have vitamin K, boron, magnesium, various other nutrients that work together. So it's not just a matter of calcium. You need phosphorus, calcium, magnesium, vitamin K, boron, etc. And if you're on Coumadin or something, they're probably keeping you from eating green leafy vegetables, which means you're going to be deficient in magnesium, you're going to be deficient in vitamin K, and that creates all kinds of new problems. A lot of people are put on Coumadin, warfarin, these blood thinners, because they had a heart attack or a stroke, and then they develop AFib, irregular heartbeat, because they don't have enough magnesium now in their system. The third leading cause of death in the United States is quote-unquote properly prescribed medications. I'm not telling people to get off them, but a lot of health conditions we see in our clinic here are the result of medications that people were put on for something else. They euphemistically call it side effects. If you listen to the drug ads on television and you get past all the clutter of the music and the visuals of people running through daisy fields and everything, and if you can really pay attention, which they don't want you to all the side effects, you'll be shocked that most of the drugs they advertise on TV have death as one of the side effects, or maybe damage to the very organs they're trying to supposedly help. Cholesterol medication causes congestive heart failure. Lamisil for toe fungus causes liver failure. Okay, so you have that information. Now, I also gave you out the joint solutions because I wanted to tack that on here. I mentioned that a lot of joint pain comes from tight muscles or maybe misaligned bones. And we have a product here that I want to emphasize, which is called the HA Plus. We've had people that rebuilt the cartilage. What is cartilage? Anyone know what cartilage is? It's the kind of smooth, soft cushion on the ends of bones.
Did you get the vegetarian?
Well, we do have vegetarian through Douglas Labs at this point. Yeah. So anyhow, the HA Plus it comes from chicken collagen, but then we have the hyaluronic acid by itself that comes from vegetarian sources. So this is an ingredient that your body uses to rebuild cartilage and discs, which are the cushions between your vertebrae and your back and neck. And your body can rebuild itself. Your body can remineralize the bones. Your body can rebuild the cartilage. The body can heal itself. Just imagine you have a piece of furniture and you scratched it, a wooden piece of furniture. 50 years from now, that scratch is going to be in there. Let's say you dent your car. Unless you get that repaired, it's going to be there. It's not going to correct the dent overnight. But if you break a bone and you're halfway healthy, the bone will rebuild. If you scratch yourself, the skin will heal. Your body is alive. Your body can heal itself. If you provide it with the nutrients it needs and you have proper conditions like enough digestive enzymes and hydrochloric acid. So you see, there's a lot to this. If you go to a conventional doctor and they find you have osteoporosis or joint pain, they're just going to want to put you on drugs. Instead of trying to re-energize the body to the point that it can heal itself. So we've had people avoid knee replacement, hip replacement, et cetera, with the HA+. Now, in the interim, let's say you do have some pain. We do have some products called X-Flame and Inflame that can help with pain. We have articles over there by the food on the metal spinning literature rack about the hazards of anti-inflammatory drugs, both the steroids and the non-steroidal, causing bleeding and all kinds of other problems. Just think of Vioxx. It killed approximately 150,000 people in the United States. It was an arthritis pain drug. You know, they took care of the arthritis pain by getting rid of the arthritic person. Person doesn't have any pain anymore. They're dead. And you know, the Food and Drug Administration didn't take the drug off the market. Merck, the manufacturer, took it off voluntarily because they were losing so much money on lawsuits, and they settled out of court for about $4 billion, which is not very much money to them because they made $44 billion on the drug. So it's just 10%. It's the cost of doing business. They know that these drugs kill people, and so if they have to pay out $1 billion or $2 billion, they make 30 or 40 or 50 billion on it. All right, before we go to questions, and I don't know what happened, that lady that wanted to ask me about osteomyelitis. Hopefully she's here. Ron, would you want to come up a minute? This is Ron. And Carol, can you hand me that picture right behind you of Ron's ear? Yeah. Ron happens to be here today. Ron came to our wellness event last October, and he had this giant ear tumor, okay? And it was on his left ear. Turn around. Now, he might need it cleaned out a little bit because there's a little dry blood, but can you turn a little bit so you're facing the window, Ron? Can people see his ear now versus the way it was a matter of months ago? Someone knocked on my door. He did not have an appointment. How much did I charge you for talking to you?
Nothing.
Thank you. He came here to one of these wellness weeks. Someone knocked on my door and said, you got to see this guy. He had this giant tumor growing out of his ear. He didn't want his ear chopped off. He didn't want to do chemotherapy or radiation. And I wrote down on a piece of paper what to take, dietary changes and supplements, and he did it. And guess what?
It went away.
It went away.
It went away.
So you still have your ear, you still have your balance and everything else, right? And you're what, 74, 75? How old are you now?
I'm 70. I'll be 77 at the end of this year.
Oh, well, I thought you were 74 when I saw you, and that was only 6 months ago. Okay, maybe.
Well, but by the way, I have a daughter who's an RN, and she's over 85 people out near Napa Valley, and she wanted me to go to the medical doctor, and her and I, we've not going to discuss it. So I told her over the phone. I told her what happened to it. She said, that's good, but she's still an RN.
Yeah, well, she's a registered nurse, and she's been brainwashed by her training.
Hey, they're living in a $700,000 house.
Money talks. Now this is a whole other thing, and I don't want to malign your daughter, but the thing is that if you're very successful financially in what you're doing, you don't have a motivation to change it, right?
Right.
Yeah. So, it's working for her, whatever she's doing and her husband's doing or whatever. So most medical doctors and health professionals are not going to be motivated to change what they're doing because they're already making money. Well, thank you very much, Ron.
Yeah. She's not 70 years old yet either.
Oh, yeah.
She's not 70 yet.
Oh, well, how old is your daughter?
She's 30. She just turned 38.
Is that the one you showed me pictures of the wedding?
Yeah, well, I had a couple pictures.
Yeah.
But I have a picture here with her and her one daughter.
Well, you'll show me afterwards, okay?
Okay.
Because I got to get to some questions.
Okay.
Okay. Anything else you want to say, or you want your own picture here?
Yeah. Okay.
There you go.
Okay.
I give him a hand for having the courage to buck his family and buck the medical profession. All right. So the body can heal itself. If we can get rid of tumors, or if your body can get rid of tumors, it can do anything. So we want to open this up to questions. I don't know what happened to the lady with the osteomyelitis relative.
I have a question. What did he take to get rid of that?
What did he take? Well, as I recall, he had the reds, greens, and purples powders, mycoceutics, the 10 mushroom formula, vitamin D3, burdock complex, wobenzyme, which is an enzyme that chews up tumors, and turmeric with a pinch of black pepper. Does that sound about right, what we recommended?
Yeah, it was also DMG.
Oh, yeah, dimethylglycine. Thanks for bringing that up. DMG, which actually has a patent for certain forms of cancer. So it was a number of supplements, and then dietary change, and the body healed itself. Next question. Myrna.
Would you please compare, you were talking about digestive enzymes.
Mhm.
Would you please compare DGL, the licorice, to Cyve and Probzon?
Okay, she wants me to compare DGL, right, diglyceride licorice. Diglyceride licorice is not a digestive enzyme. It's an extract from licorice, not the candy, which really isn't licorice, that helps to heal the digestive tract. And we have that in our GI Complete, which comes in powder and pills. So that's to help heal irritation or damage to the digestive tract. Now, the Probzyme is a chewable digestive enzyme with a lot of probiotics, especially good for children that have problems. Maybe they've been on antibiotics and killed off their probiotics. Or kids that have digestive problems because maybe they're allergic to some of the food they're eating. Of course, dairy products are one of the most common food allergens. Then we have the Betazyme, and that's especially good for people who had their gallbladders removed or have trouble digesting fats. And then we have the Cybezyme, which is a vegetarian product that I use most of the time. I switch between the Probzyme and the Cybezyme, which is a high-potency digestive enzyme. It also has some probiotics in it. So it all depends exactly what your situation is, which one might be ideal, but any of them are very useful, of the Probzyme, Cybezyme, and Betazyme. But DGL, liquid or powder, is not for digestion. That's to heal the digestive tract. Other questions? Yes, Kathy.
Are strong bones inherited?
Well, you're going to have a genetic predisposition. This brings up a whole thing about genetics. And people have this notion, because I guess they get it from the medical community, that people have a genetic predisposition. You know, my grandmother had allergies, my dad had allergies, I have allergies, my grandparents had heart attacks, my parents had heart attacks, I have heart attacks. But a lot of it can be environment. Maybe they're all eating the same food. So their internal environment is affected by what they're eating, for example. So yeah, some people we're all different. Some people have stronger bones than others. But given that, you can actually affect your genetic potential. And there's a whole science now called epigenetics, 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 that is recognizing the fact that you can trigger genetics for good or evil. So you might have good genetic tendencies or bad genetic tendencies, and they will be stimulated or suppressed depending upon what you eat and various other activities. Of course, what we have to mention for bones also is use it or lose it. They found that astronauts being in space away from gravity for just a few weeks actually had bone loss. So your bones are designed to handle your weight. They're designed to have some activity. So even if you're in a wheelchair or something, you need to have some sort of activity. And of course, there's a thing called sarcopenia, where people lose muscle mass after the age of 40. So it's even more important for senior citizens and, let's say, people over the age of 40 to do some sort of exercise, according to their capacity. In fact, someone showed me a picture of a guy. He was 90 years old, walking with a walker all bent over, and then he started doing hatha yoga and strengthening exercises. In 92, he walks normally, standing up straight. So what happens is that people lose their core muscles, their thighs, their abdomen, their buttock muscles. And so it's very important to exercise, and that's a whole other subject, but that's part of having strong bones and being healthy. Yes?
What's your opinion of the power plate or the Euro Shaper to help build muscle or the vibrating machine?
Yeah, well, vibrating machine that's very passive. I actually have one upstairs. I bought it at an anti-aging show about a year and a half ago. I never took it out of the box. You reminded me I got to take it home and start using it. Well, there's various types of machines. Of course, there's exercise machines. I think it's, you can do isometrics too. Let's say you have a 30-pound weight and you're going like this. You can do the same thing without any weight. You just tense your muscles and pretend like you're pulling something up. And that actually is just about as good as using weight training. So you can do exercises without any machines. What you're talking is a very passive thing. You're jiggling around. That at least does improve circulation, lymph and blood circulation. I don't know if you're going to build muscles that way. I might lose some fat that way. Anything you do is better than nothing. Yeah.
You said about people who are on whatever medicines and the purple legs.
Purple legs, they were on blood thinners. Blood thinners.
What can one do to reverse?
Well, they probably need to get off the blood thinners, taper it down. And there's a lot of things, if you think thinning the blood is going to prevent heart attacks and strokes, garlic, vitamin E, there's all kinds of things that can help prevent strokes and heart attacks. We have the Nattokin Plus, lumbarokinase. So medical doctors are not trained in these things. They only know drugs because their education is controlled by the drug companies, and so they memorize drugs. It's like we're speaking English. We're not speaking Swahili or Chinese because probably most of us here don't know those languages. So all they know in school, like Ron's daughter, who's a registered nurse, is what they're told in school. Now, the rare doctor or nurse is someone who thinks outside the box and starts looking for things other than just treating symptoms with chemical drugs. You have to understand, the drug companies are not in the business of healing people. They're in the business of making money. So someone on the Facebook page today asked me, she has a plantar wart. Now, she misspelled it. She spelled it Planter, like someone who plants plants. It's plantar, Plantar, because the sole of your foot is the plantar surface of your foot with an AR. But anyhow, she has a wart on the bottom of her foot. I told her to put peroxide on it and then get a sliver of garlic, fresh garlic, and tape it there. Now, do you think the drug companies want you to know that? How much money are they going to make off of that? How much money am I making off of that? Nothing. But if they can sell you a drug for a couple $100 a month, it maybe costs them 10 cents to make, then they're interested in telling you about that. And so medical doctors had their education totally controlled and funded by drug companies, so they're never going to use a less profitable procedure product when there's a more profitable procedure product available, even if they're not directly making money out of it because they don't know about the alternatives. It's like a friend of mine's friend had an eye infection. I told him to put colloidal silver in his eye, and I told him to go to the drugstore and get boric acid solution for the eye. We used to have that at home when I was a kid. Instead, he went to the medical doctors. They gave him steroid drops, and I said it's going to make it worse. It did make it worse, and then he had to go on antibiotics. And spend a couple $100, and So the thing is, you're not going to find out about these low-risk, very effective, low-cost home remedies from medical doctors. They don't know about them. Yes?
Can you talk about 50% dental bone loss, and can you regrow that bone?
Yeah, dental bone loss. Well, there's probably two factors involved there. One is the nutritional factors that we talked about for general bone loss. The other thing is the mouth has a lot of bacteria. and the bacteria secretes acid. And the acid directly will eat away the bone loss. Cause the bone loss, eat away the bone. And so what happens is the gums recede. If you have receding gums, it's probably because bacteria is eating away the bone that the gum attaches to. Gums do not attach to your teeth, they attach to your bones. So if you ever see like a skull, you'll see that the tooth is there, and then there's like a sleeve of bone around the tooth. And that's what the gums attach to. But if the bacteria starts secreting waste products that are acidic, it starts slowly dissolving that bone. If we're talking about jawbone, I should think that the SuperCal Plus, vitamin D3, taking Betazyme, that type of thing, would rebuild it. If you're talking about that little sleeve around the teeth, that may or may not remineralize. I don't know if it's going to regrow, but what's left will remineralize. And I've heard many dentists tell me that they've had patients with loose teeth, and then they start taking nutritional supplements, etc., and then the teeth aren't loose anymore because the bone around it starts getting stronger and thicker. And also, dental hygiene is another whole area. You can rinse your mouth with hydrogen peroxide twice a day. You need to learn how to floss properly, which is taking the flossing string and wrapping it around half the tooth and going underneath the gum and pulling up. You don't just put it straight in between the teeth. You have to wrap it around so you get the front part and the back part of the gum and slip it underneath the gum and pull it up. And then you do the other side, and that way you get the whole circumference, because you want to get the bacteria and gook out from in between the gum and the tooth. And if you're just flossing between the teeth, you're not accomplishing that. You've got to wrap it around and get it underneath the gum. Okay, well, you've been a great audience. I'm going to give you about 10 minutes break if you want to talk to me. I'm going to run over there for a second. I'm going to get you the articles on bone drugs and dairy and all that. And I'll be up front here. We're not here, but, what is back to you, so that I'm not interfering with the next speaker. So keep in mind, our phone number is 412-922-WELL. Our address is 2419 Baldwick Road. You can see us on Facebook at Weiner Wellness Center or James Weiner, or our website, drweiner.com. You can sign up for the email newsletter. Anyone here signed up for the email newsletter? Okay, anyone here have email address and didn't sign up? You ought to sign up. It's free of charge. Thanks for coming. God bless you.